Health service delivery to all in Ghana faces many challenges. In rural communities, geographical access to health service is limited. There are not enough health posts to cater for the dispersed communities. The community-based health planning services of the Ghana Health Service was initiated to bring healthcare to the doorsteps of the people.
The concept of bringing CHPS to the Upper West region was to address their high infant mortality and maternal mortality. In fact, their health indexes were so poor that we saw that there was the need to catch up with them.
We realized that our people did not have access to health services. They had to walk more than 15 kilometers, others 30 and even more to reach health services.
The Ghana Health Service adopted CHPS as a fundamental strategy to improve access and equity to vital health information and package of services.
The idea was to build primary healthcare posts in remote localities and embed healthcare workers within the communities. In the Upper West region of Ghana, 197 CHPS compounds were planned to be built by 2012. The Somboro CHPS compounds serve 4 communities with a population of over 1,500 people.
Currently, we have 2 male CHOs, that's community health officers, working from the compound. The reason why we have put male CHOs, and even for that matter 2 CHOs, is for the fact that the road is inaccessible, especially during the rainy season. And even during the rainy season, most of the communities are cut off. If you put a lady here, the lady is not going to be able to ride and go through the difficult terrain to be able to get to the people to provide health services.
The health officers provide health delivery services daily. Today, Bertinus is on duty at the CHPS compound, seeing to the clients who walk in throughout the day. Common ailments he deals with are malaria, diarrhea, and skin diseases.
CHPS is about prevention, encouraging prevention, but if one falls sick, they normal come.
Members of the community spoke about how the CHPS concept has improved their lives.
Entolan to be in a damantola to what one getting as a bully. Carimne mam embare back on Ghana and Carimne cut the silver could be to combat Rogacha Ponesen.
Felix is out doing home visits. He does this regularly. His motorbike is critical to reaching the 4 communities under his watch. He talks to a community member about their health needs, with a focus on preventive health. He tries to catch potential problems early. He takes a look at the child welfare care card that details the child's medical history. There are, of course, cases that are beyond their capacity. In such cases, they need to mobilize the community health committee.
One of the cases that we could not manage and we were compelled to refer was that a woman who lived in one of our furthest community, the woman started at the house with slight bleedings, and before they realized it was severe, this man carried the woman on the motorbike, and on their way, the motorbike broke down. And they could not do otherwise than to walk another distance to a nearby house to beg for a bicycle for the man to carry the woman to the compound. When they arrived, we realized that the bleeding was so severe that we cannot manage that case here. I rushed to the community head to quickly organize and get a motorbike to send this woman to our sub-district, which is 21 kilometers away from us.
The people of Somboro have a health committee made up of 13 people from the community. CHPS does not only render services to the people, it also engages the community to mobilize resources to meet its own health needs.
We have this in contribution. Each member, a woman or a man, should contribute 5,000 each, so that we deposit in bank. In case of emergency case, we then call upon ambulance, then send the person to the nearby hospital.
Implementation of the program is not without its challenges.
The road network is very, very bad. Access to communities to render services is just not good. Electricity to sustain these cold chain boxes or vaccine carriers at the community level is a problem. Why? Because electricity is not connected to these areas. So therefore it makes it difficult for the CHO to maintain vaccines at her level.
Last year the region experienced flood from July till about somewhere in October. It actually affected a lot of the community. Accessibility to those communities was not easy, and that slowed our work. UNICEF sponsored 15 CHPS compounds. Initially we started with 10, then we added 5 to it. Now all CHPS compounds have been constructed and 3 are fully operational.
The CHPS concept is a key strategy of Ghana Health Services' current 5-year program of work. It's aimed at addressing the geographical barriers to accessing healthcare, especially in rural communities. The government alone, for obvious reasons, cannot meet all the challenges of scaling up this important venture countrywide. I'm therefore taking this opportunity to call on our development partners and other stakeholders to collaborate with us and support this important venture as part of our collective effort to achieve the health-related Millennium Development Goals.